Very much for the kind introductions up here. I'll be more than happy to take questions while I speak, or you want to lead with the questions, that's
Yeah.
fine.
All right. To start it off, Dr. Ali, could you give us a quick overview of what cardiothoracic surgery fellowships are like and what the training usually involves?
Okay, so I can only speak about how things go in Pakistan as well as in UK. So in Pakistan, as we all know, that you have to do your FCPS Part 1, and then you have to get involved with 2 years of general surgery training, followed by 3 years in cardiac surgery. This is not a cardiothoracic surgery training in Pakistan. It's just cardiac surgery in which you do 3 months thoracic. The thoracic surgery is a separate entity in Pakistan. Whereas in UK, it's the similar mechanism. After you get your GMC, you get enrolled with a cardiothoracic surgery training program where there are two ways to go to enter in cardiothoracic surgery training. Number one, you get admitted in this training program at the level of ST1 or CT1, I would say, in which they rotate you exactly like Pakistan through general surgery rotations. And then at the level of specialist training 3, year 3, you get involved in cardiothoracic surgery. And then you start off your training, and that's for 4 years, 4 or 5 years. But in the major difference is that you have another pathway in UK in which you enter directly into ST3 if you have done your general surgery bit. However, this is closed at the moment because there are a lot of recruitments that has happened in the last few years.
All right. Dr. Ali, can you share some common or maybe some complex procedures of CT surgery that you might have had to perform or gotten a chance to observe and assist on? And how do you think your training helped you get comfortable with these?
Okay. So the complex things, just at the level so that everybody can understand, is an acute type A dissection. So in which there is a split in the wall of the aorta, and you have to replace that bit where initially the split has occurred. So this is the simpler, complex version of the cardiac surgery that you perform, in which you have to be sure that you perform this operation with the integration of anesthesia, perfusion, as well as scrub nurses as well, because all aortic dissection are different operation than one another. So this was the most complex bit that I have performed. And the training which played the most important role was not only just the surgical skills, but safely communicate with each and every department, like anesthesia, like perfusion, who control the cardiopulmonary bypass, because you have to be in constant communication throughout the surgery, that what sort of a temperature you will want, what sort of pressure you want to maintain while we are on cardiopulmonary bypass and stuff like that. And then obviously the scrub nurses, that you change a decision on table while the patient is being operated on. So you have to make sure that you open the right grafts, because every graft is a lot of money. So you have to be sure. So everything had played a very important role at some point, which I was trained in: communication, surgical skills, making assessment, making good decisions. So all of that counts.
All right, thank you for sharing that with us. Going off of this previous question, can you share a bit of your personal journey and any memorable experience that really shaped your path?
Yes. So the most important thing that obviously everybody goes to school before going to med school. So you make a lot of friends. You tend to not be in touch with them or be in touch with them. It depends from person to person. But then at times the friends or colleagues that are in school, if ever later in life we meet, then you realize how far you have come up. So similar sort of a thing happened. Like I was on call in Karachi in cardiac surgery when I just started, and cardiology department admitted a patient with acute myocardial infarction and was doing really poorly. They couldn't do the stents or the PCIs because of the nature of the anatomy of the coronary arteries. So they called in for help. And that was the Eid day, Eid first day. The patient was as complicated as it can be preoperatively. And obviously, as part of the assessment and going through the risks and benefits of the surgery, you involve and to talk to the family as well, because it's a major operation. So while talking to the family, I got a chance to meet his son. And turned out that that was my school friend, which I wasn't aware about. And after the operation and after the patient was fine, I took this opportunity to catch up with my friend. And he said, you actually did what you said in class 7 to our class teacher. You know, when the class teacher comes up, first day introduction, the ice breaking session, and they ask what you want to do and where do you see yourself in 10 years? Very typical question. And you just, and in the class 7 and 8, you just answer that casually.
Sorry about that. Please go ahead.
So this really stuck to me, and I think it will remain stuck to me for the rest of my life.
That actually sounds very inspiring, Dr. Ali. All right, so I wanted to ask you, as there's been a lot of buzz around new innovations and technologies in CT surgery lately, right? Like minimally invasive techniques, transplants. So could you share a bit about what's exciting in the field right now? And if you think somewhere along the line, if interventional cardiology could take over CTS?
Yes, it's a very good question, a very good thought. A lot of innovations has been going on recently. I have been involved in a few relating to AI, which I'm going to talk about in a bit. But minimally invasive and these things are there for some time now. However, the innovations that I would say is not minimally invasive surgery, but the assessment to reach the operation that you want to do. I'll give you a very small example. The CT, the level of CT and the 3D CT has gone so far that that it can predict what sort of incision you want. How do you want your incision? Where do you want your incision? How much of an incision would make a difference? And exactly what you would find inside, what's going to be the anatomy, especially in congenital heart surgery when every heart is different. And it's very important to have that 3D printing. So you operate on that 3D print before you go even operate on the patient. So you have an idea, or you already have practiced that what you will see inside. Second and most fascinating thing which I saw recently was actually it's called navigational biopsy. So you load a CT on the system, and the CT will navigate through that bronchial tree from trachea to the exact bronchi where you can find the tumor to biopsy it. So what you do is essentially once the system is loaded and ready to go, once you have loaded the CT and told that system that there is a tumor there, you essentially what you do is you connect that system to your bronchoscope, and you just follow the navigation, which exactly like you do in maps. It will keep on telling turn left, turn right, turn left, literally that, and you will reach that tumor, which is amazing.
Mind blowing, yeah.
And last question, will intervention cardiology take over cardiothoracic surgery? I personally think no, because there are a lot of things that you can't deal with intervention. Even in the era where there is TAVI, which is done right, left, and center, uh, not everybody is feasible for TAVI. Somebody's coronary anatomy is different, somebody's aortic anatomy is different. So no, there will always be room to do surgery rather than intervention.
All right. And finally, for all students and trainees tuning in, what advice or guidance would you give to those who are thinking about pursuing cardiothoracic surgery?
Number one, you have to be very, very, very clear that your working hours is going to be long, what will be tiring, because number one, any intervention field, including intervention cardiology, demands a lot of work and demands a lot of time. Second of all, if you plan to come to UK, then make sure you go through the matrix of how to apply in cardiothoracic surgery and get into a training post. It's much harder to navigate your way to become a consultant if you are a non-trainee. Even taking exams like FRCS is a bit tricky if you are not a national trainee. So you have to be either excellent in what you do or an outstanding. And third of all, if you think about coming to do electives, then be focused why you want to do electives. It's not just about spending time to just work in UK or shadow somebody. It's not enough. You have to compete on the ground level where this world is competing to get a training post.
All right. Dr. Ali, do you have something that you want to talk about, or should we start taking questions?
I think I'm happy to take questions.
All right. So there's one that says MS or FCPS. Which one is better in your opinion?
Okay. In regards to if you are competing against the world or just in Pakistan. So if it's just in Pakistan, then yes, FCPS is the way to go. I'm not sure about MS because it was a new program when I left Pakistan. I'm not sure if a good institute, a reputable institute like Shaukat Khanum, AKU, Shifa, and all these will take you as a consultant if you have done just MS. I'm not sure of that. However, just try to get established fellowship rather than any alternates, just to make sure that you don't end up in any situation which you don't want to be in.
All right. Next one. How did you prepare for such a competitive specialty in medical school?
I didn't. However, I was sure that what I want to do is this, but I just went through what is essential criteria and worked it from there. And you have to be honest to yourself. You have to identify what's you're lacking in CV. That's it.
All right. How did you deal with your first patient loss? I feel like that's a good question.
It's still as fresh as it was on day one, and I still feel exactly the same after if my patient is doing not well. And it's really hard. Number one, the way to cope is, for example, it's always cardiac surgery is a teamwork. So you sit down with that team which was there, you identify the points which can be improved, work on your skill. It's hardly a skill issue ever. If the patient is not well, then it's hardly ever a skill issue. Everybody can stitch, but it's just the decision making which makes a huge difference. So just go back to basics. What made you decide that? whatever you decided, and was there any room for improvement? But always be honest to yourself that where did you lack, and be open to accept mistakes.
Makes sense. Next question is important things you can do during med school to increase your chances of getting into surgery.
Yes, it's a very good point. Every year in UK, I can only speak for UK, they release a matrix, which they released, I think, last week for cardiothoracic surgery. It will exactly tell you what they want from a person who is applying for a trainee. This is a very good guidance who is not even applying to become a trainee. For example, you need 5 audits, you need 15 stenotomies, you need 5 vein harvest. So you would have an idea where you are standing and what you need to work on. You need 5 publications, so might as well start early to understand how research works and start getting involved in projects in your local universities and hospitals rather than getting involved in UK from Pakistan. This is almost impossible. I wouldn't say impossible, but it's very hard because of patient confidentiality and other issues that come up. So it's better to get involved in research in your local hospitals. I'm sure there must be somebody who is academically sound. 1 or 2 people are always there in every department who are into academics. So learn from them, get involved. Don't run after getting your name getting published, but at least you get the experience and then you start your own projects.
All right. There's another one. Do cardiothoracic surgeons need to deal with vascular diseases?
Yes.
They do.
Complex aortic surgeries are always dealing with vascular problems like femoral arteries, like celiac, SMA, IMAs, everything.
Okay. The next one. When did you truly doubt yourself during this path, and how did you pull through?
It happens on, I would say, frequent occasions. Every year or couple of years, it comes to be that whether I made the right choice. And then you just go through all the basics, that why you chose that field, and then every month or two you get a patient feedback which just positively reinforces your decision. But I'll be very honest, it's a reality. It will hit you when you are working really hard or you lose a patient or something happens that you don't like. Even like, for example, if your audit doesn't get published or your research paper doesn't get published, you really question your life and your life choices. But you get around it with time. You just need to give yourself some time.
Makes sense. Someone's asking if there is any fellowship in hepatobiliary and pancreatic surgery in UK.
Yes,
Would you
there
have to
is.
be?
They do upper GI, lower GI, and different sort of fellowships, including the transplant of hepatobiliary that I'm aware of.
All right. Okay, so as medical students, we often hear rumors that it's not easy and difficult for IMGs to match and pursue a surgical career as compared to medicine in countries like US and UK. What is your opinion on this?
I can't say anything about US because I'm not
US.
familiar. However, I can tell you there are Pakistani graduates who have gotten in cardiothoracic surgery training in UK. You just have to follow the matrix. Just open Oriel website or Wessex Deanery website. They have explicitly told you what they need. If you fulfill that criteria or become eligible, then definitely you're going to get it.
Do you think it's worth it applying to UK for surgery? Because recently I've heard news that there are very low jobs in the NHS and stuff like this. So would
So
you
that is
suggest it?
true. Jobs are very low, but I'm talking about training positions. Training
Mm-hmm.
positions are almost constant every year.
All right.
Getting a job in UK is can be demanding, can be very frustrating when you are on applying on a junior post because there are a lot of people applying throughout the world. But as you become senior, it gets more and more niche. But that also means the job market will go really, really low. So it depends how good you are, or uh, I don't think that really matters. That if there are low jobs for IMGs, they would consider anyone with skills, and a genuinely good person should be able to get a job. But you
All
just
right.
know the right people, yeah.
Okay. What there's a question that says, how important is research in pursuing surgery? Will I be able to do surgery without doing any research?
I'll be brutally honest. You will not go anywhere without any research.
Yeah.
Simple, one line answer. Nobody will check how are you operating inside theater. Everybody sees how you are outside. 5 people who scrub with you know you inside how you work, and that's it. Nobody knows those 5 people as well. So the only people who know you outside is through your research or your non-clinical skills.
Right. So, in your opinion, what can a person do to guarantee a spot in a good internship or observership? Yeah.
Okay. So number one, identify why you are joining that internship or observership. If you think that, for example, there is a very good research opportunity in transplant and you want to do transplant in later in your fellowships, you target those institutes which do research, like Harefield Hospital. So you just get involved with the person who is the lead or is academically sound in that transplant, in that institute. You just link up to him, get involved in research, and that's how you do it. Do, don't
Um,
don't go without planning. Yeah,
all right. How would you suggest that medical students look for opportunities like shadowing doctors in the UK?
yeah. Again, I would identify why you want to go there, because
Mhm.
clinical work is exactly the same what's happening in Pakistan and AKU, Dow, Civil, wherever. It's almost the same.
Yeah.
There is no point on exposing yourself to something which you are already being exposed without spending so much money.
Mm-hmm.
However, what you need to identify is before you apply and you are emailing some consultant to get shadowed under, you have to tell them that you are coming exactly for research or for audit. You want to see how it's
Yeah.
done. That's it. But obviously, when you go to meet a consultant and shadow them, they expect you to be to know what they do themselves as well. Like, for example, if a student comes to me for shadowing through my 2 weeks, if he or she is shadowing me in theater, I would expect them to know basic anatomy at least. Without research or without studying what am I doing, it's a bit of a struggle to go through that 2 weeks with them.
Understandable.
If
All
your
right.
basics are not right, we can't build up.
Yeah. So someone asked, I want to build a surgical career in the UK, but I don't understand why MRCS is discouraged these days. People are
Okay.
demotivating and saying that do MRCP or you won't secure a job as an IMG.
Okay. So it doesn't matter if you do MRC or MRCS, but it depends which field you want to choose. If you want to choose surgical field, having an MRCS is an additional point. Again, I would refer to the matrix that I was talking about, which they have published for cardiothoracic surgery. It's 3 points for MRCS. Every half a point will take you back at least 50 positions down. So you can
Mm-hmm.
imagine the amount of competition. It's a certificate to say that you are competent at the level of UK graduate which has done 2 years of core surgery training.
All right. The next question we have is, when and where did you do your internships and observerships?
Okay. So by internship, you mean house job? Because I did my
Uh, I
intern.
think they mean shadowing in the UK, if you did any.
Okay. So because in AKU we call it internship, so I got confused. What internship are you talking about? Okay, so observership or clinical attachment, I just did once in Newcastle Freeman Hospital in congenital and transplant in 2018. However, this did not lead to my job. I'll be very honest, I'll be very clear. If you think observership, internship lead to you a job, think again.
All right. Okay, what are some common interview questions to prepare for, and how can we guarantee that we make a good impression?
Very good question. There is a book. It's called Interview Skills. I'll grab that book at the end of this conversation. Just remind me. I'll show you the book.
All
It's
right.
a brilliant book. Even if you read it just for your own development, it's a brilliant book. I really like it. I highly recommend it. A lot of consultants in their consultant interview recommend to it.
All right. Moving on, there's one that says, is it true that Royal College members and fellow has a good practice opportunity in the Middle East?
Depends what level you want to work on. If just a registrar or a RMO sort of a person, then yes. However, if you want to work as a consultant in Middle East, you should have uh, a CCT or completion of training certificate from UK, and that will boost up your chances to become a good consultant in Middle East. If you just want to be a doctor in Middle East, that any certificate is more than enough, but it won't amount to anything.
All right. Um, Someone is asking, what do you think led to you scoring your current job?
Very good question. I would say number one, reference. Wherever I have worked in UK, they literally just picked up a call and just told them that you need to take this guy. Number two, my 4.5 years in UK, how I have put it on my CV. It shows a lot of hard work in 4 years, because I did quite a bit of research, about 8 or 9 audits. I did my certification of Royal College of Surgeons, and that too, it's not an international one. It's the one which the national trainees take, that exam. So I think it was pretty evident on my CV that I have worked hard in 4.5 years. And of course, you talk to them before even applying for a job. You go, you meet them, and you tell them about yourself, because they don't know you.
True. All right. There's one more. CT surgery is incredibly demanding. How would you avoid burnout or like maintain a work-life balance?
That's a very good question. So a good thing about UK is you get off days, 0 days it's called. I try not to work on my 0 days,
Mm-hmm.
although I have to. That's a different issue. But
Mm-hmm.
you have to engage yourself in a different activity. For me, it's tennis. I have to go. I make sure that I book my session well in advance, so that I don't commit myself to work commitments in my 0 days or weekends or something. So I just go play for 3 hours twice a week, and I do not touch my phone in it. So it just makes sure that I am not losing my focus out.
Yeah. Okay. I think that goes for all medical students. They have to have something, right?
Yes.
Okay, someone's asking how long after graduating were you able to get your current job?
Okay. I don't think that matters because I graduated in 2011.
Mm-hmm.
However, if you say how much time it took for me to be able to apply now for a consultant job, it took me 5 years. But more than graduation, it is since how long it took after I completed my cardiothoracic surgery training. So I finished my cardiothoracic surgery training in 2019 in Pakistan.
Okay.
So it takes some time, but requires a lot of effort in those years because you have to match the national trainee, which is over here.
All right. Do we have any more questions, guys? I don't think we have any more questions, Dr. Ali.
Oh, there is
Oh,
a
we have
question. Where
one.
did you train
Where,
for your cardiothoracic? So
yeah.
I did my initial bit in Tabbahat Institute in Karachi, and then I did a congenital in for about 2 years, 2.5 years in NICVD. That's National Institute of Cardiovascular Disease. That's also in Karachi. And then I moved to Leicester and did 1.5 year of congenital and complex ECMO fellowship in Leicester. Then in order to get my sign off for FRCS to prove my competency, I did 2.5 years in Guy's and St. Thomas's where I got my certification for my FRCS. So that's my journey.
Is there a difference between cardiovascular surgery and cardiothoracic surgery?
Yes, in US it's cardiovascular and UK is probably cardiothoracic. I think that's the difference. But otherwise, I don't think there is any difference.
All right. Okay. Yeah. I think that's it for now. Dr. Ali, how about you bring that book out and
Oh
let
yeah,
us know
let
the
me
name?
grab it. Just give me one moment.
Sure.
Yeah, so it's called A Comprehensive Guide to CT, ST, and Registrar Interview Skills. Over 120 medical interview questions and techniques and NHS topics explained. That's the book. Wait just a second. If you can see this.
Oh, perfect. Thank you so much, Dr.
Yeah.
Ali. I think that's it for today.
I'm happy to be contacted over email, LinkedIn, Instagram, wherever you guys are happy.
All right. Thank you so much, Dr. Ali, for taking the time out to be here with us today and sharing your journey and experiences. It was incredibly insightful. We appreciate your time and we hope we can have you here again with us.
No problem at all. Pleasure is all mine.
Thank you so much.